There's the one that just goes on your face, then there's one that goes down your throat that helps you breathe, and then there's one that they put you to sleep, and that's like they knock you out so that you're unconscious for however long they need to, and it helps you breathe. So they put me on the second one because the first one wouldn't work. Sorry, this video is getting long. And they told me, well, I don't know, it was a really creepy room. It was just this room, like, of bright lights, like I was a dead body, and they were all just right there, and, they started to put needles in my wrists, like, they had to sew a needle through my artery to try to get my heart rate and all this blood pressure crap. That killed, because they were idiots, and like, is it okay if a student tries on you? And like, I can't freaking speak, so they just let the student try. They fucked up twice, and then finally the guy's like, okay, I'll just do it, and I was like, in my head, like, you're a fucking idiot, like, excuse my language, but ow, because like, they're really sewing through your vein in your artery, so it was painful. So they kept me there for about 3 days, and I wasn't allowed to see anyone. My mom wasn't allowed to come in because it was like, I don't know, I was just blocked off. They didn't want germs getting me or anything. I wasn't allowed to eat, nothing. So they were monitoring my heart, and I couldn't breathe without this tube. They would try every day, and I just couldn't. Immediately my heart rate would drop, and I would be out of it. So that really sucks. And then they said, you know, if this doesn't improve in a couple of days, we're going to have to take you to the intensive care, which is where people die. That's where your last stop is, at the hospital. So I ended up having to go to intensive care, and honestly, it was so lonely. And right across from me was like this, like, I guess people who are dying in jail go to the place right across from me, and there was this guy who was really sad. He was maybe in his 90s, he was trying to sit up and see his family, and like, they were pushing him, the cops were pushing him back down, and it was really depressing. The only good thing about intensive care was they had a TV, and I could not eat for a good straight 2 weeks. I was pissed off. I would bawl my eyes out every day because my mouth was so dry from this mask. And they finally decided that since I wasn't getting better, it was time to put me out for a couple days because nothing was improving. So I had this tube down my throat for a good week, and I was unconscious. And I woke up, and I remember them telling me that they would have to do it, and I was bawling. Like, my mom was there, and I was like I was terrified. Like, so scared of what was about to happen that I remember it, and I was just like, I was screaming, I was freaking out, like I was having a panic attack over them even talking about it. So when I woke up, of course I was hungry as and there was this one really nice nurse, and I was like, they've only been giving me ice chips, can I please have some Jello or like something? And I hate Jello, but I just wanted like some food. And I have photos, but they're on my mom's old phone, and she doesn't remember the password. But they're really not, like, they're disgustingly ugly photos that I wouldn't want to add, but just so that people know what I'm talking about, I would really want to find them. And like, a couple of weeks after I was in there, I was able to sit up on my own and had tubes hanging from me and stuff. And they put me on like a chair to try to like exercise my body, like my back. I have all these tubes and like this mask, and I'm just like I look so bad. Like, I look like I was dying. And it's kind of hard to look at those photos. I don't know why my mom took them, but I look bad. And I also remember being in there before I was put under. They would put needles in my stomach so that I wouldn't get blood clots in my legs. And they also, and the only good thing about it is I got a lot of ultrasounds of Juliana. But I was really scared with those needles going in my stomach that they were going to affect her. You're not even allowed in here. Get out. There's a couple some decides roll on the ground. So, you know, that was how I almost died. But after that, around 28 to 29 weeks, I got another kidney infection, and this time they kept it under control. But what had happened previously as to why I got like that is because from all the saline pump like stuff they were putting in my arm, when I told her to stop and she didn't listen to me, water went up around my heart and my lungs and just cut off my breathing. Also, there was other issues added into it, but that was the main issue. So around 28 to 29 weeks, I got another kidney infection, but I caught it on time because I would always get that back pain. So I had to go back in the hospital for another 2 weeks, and it was not as bad as the first time. And I had I can't show you, but if you can see really closely, there's little marks. They used to be way worse, but I got a tattoo to kind of cover them. And I had a pick needle, which is instead of getting picked every day with a needle, it's this tube that is really long. It's about this long, and it goes up your arm into your heart, so that they can just give you your antibiotics. And I had to stay in the hospital and get antibiotics in it every day. Another thing is, after that, I was fine till about 35 weeks. Got another kidney infection, and I got another pick needle. Pick needle, it's like surgery getting it in. It's not like crazy surgery, but you are put on a bed and you know, they have to. It's a thick tube that goes in you, so it's pretty crappy. So 35 weeks, I got another one, and instead of staying in the hospital, since they were kind of, you know, used to what was going on with me, I got the pick needle, and I got to go home, and I had nurses coming in every day to give me antibiotics and do my blood pressure and all that crap. So I had a rough pregnancy, and around 37 weeks, 4 days I believe, is when I went to my OB and I said I think I'm getting another kidney infection. I'm sorry, instead of going to my OB every 2 weeks, well, in the beginning it's supposed to be every month, but in the end it's every 2 weeks. I went every week a couple of times. She says I was the worst pregnancy she's ever seen in her life. So she's like, don't get pregnant again. Yeah, but anyways, so at 37 weeks, 4 days, I went in and I said, I think I'm getting another kidney infection. She said, you know what? I don't want to put your baby through this stress anymore. If you're effaced and dilated at all, we're going to induce you. We're going to keep you on antibiotics for a couple days, and we're going to induce you. So once I hit 38 weeks, I got induced, and I had Juliana, and I was so happy that she was so healthy. She was 7 pounds, 7 ounces. I thought she was going to be a small baby because my tummy was really tiny. However, I went from 106 pounds to 142. But if she had have been in there any longer than 38 weeks, if she had went to 42 weeks or 41 weeks, they said that she would have probably been around 10 pounds. So I'm glad that she got out at that time. And all the pain that I had been through during pregnancy, I thought, you know, I'm going to try doing this natural. Because the doctor told me, well, this really hilarious nurse told me, you know, honey, all the pain you've been through, you can probably just get through it with a breeze. And honestly, I got through that with the breeze. I would say the worst thing about going through it all was just the artery needle. Oh, that was a doozy. That one really hurt. So that was probably the worst thing of my pregnancy, was the artery needle. Labor breeze. I mean, people were talking and I really wanted to shoot them in the teeth because I wanted silence, and my nurse was really annoying. But the artery needle was just, oh. And when I got contractions, they weren't in my stomach, they were like in my, like, this area, like where your crotch kind of like goes like this on the sides. And that was painful. But that damn artery needle was sore. So that's how, for those of you who keep wanting to know, you know, that's fine. If you guys want to know anything else or have any questions, feel free to ask. My Instagram is lifewithjuliahna. I'm sure that a lot of you are coming from there, but if you're not, you feel free to follow me on there, and thanks for watching my video.